I've got a number of hats on today. I'm one of the co-directors of the IAPT course at PCL, but today I'm the CBT lead as well and the supervisor lead, so I'll be talking about both of those courses. And just to clarify as well, that I think what Duncan was describing in terms of the part-time option, that's particularly about the therapy course, isn't it? Yes. As opposed to the management and the supervisor courses, which is going to be a year. So some of you again will be very familiar with the structure of all our courses, but we have a manager and supervisor course, and then we have a therapy course which has both core skills, which is a part of all the different modalities, and then there's the modalities within that are currently CBT, IPT, parenting, and systemic family practice at the moment, and there might be other ones added. So I'm just going to give you a whistle-stop tour of CBT, and I'm going to make sure I leave some room for questions, because there might well be some specific questions you have about the course. So the CBT course, just to say the core skills part will be talked about later, so that's very much part of this stream, but I think Rosalind's coming later to talk a bit more about it. So I'll particularly talk about CBT. So we've got two modules within that. We have anxiety disorders and depression. The teaching will be on a Monday or Tuesday, and in terms of specific details, you'll have a lot more of that information as we get closer to the date, certainly by the launch, if not before. So how it works is there's teaching, so there's some didactic teaching, some workshops. And then we also have practice tutoring, which is where you're in a small group of 4 people and a skilled CBT supervisor, where you will be bringing your therapy videos and have an opportunity really just to really develop your CBT skills. So it's a real mixture, as well as of course private study and assignments. So in the first term we try and cover some of the kind of core CBT areas, which include just thinking about history and the framework, thinking about assessment, formulation skills, goal setting, psychoeducation, and particular behaviour change techniques and cognitive change techniques. So things like behavioural experiments, behavioural activation for depression, thinking about challenging thoughts and other techniques. So we do a bit of a kind of 5-day, really workshop heavy to develop your skills at the beginning. In terms of the anxiety-specific teaching, you can see we cover quite a lot of different areas. So we think about kind of general as well as condition-specific approaches. So Coping Cat is a particular approach that's got a good evidence base for more of a kind of generic approach across anxiety disorders. So that's part of our teaching, but also we specifically teach models of how to work with specific phobia, panic, post-traumatic stress disorder, generalised anxiety, OCD, social phobia, body dysmorphic disorder and separation anxiety disorder. So the anxiety curriculum is then packed. And again, how we teach that is through lots of role plays and videos, and in fact, someone who did the course before has increasingly been trying to have lots of videos and of the people who are actually teaching, showing you the videos of them doing therapy or doing role plays live, just to really help teach those skills that comes alive a bit. In terms of depression, we cover assessment formulation, looking at the models, heavy on behavioural activation, that's really key again in terms of the research for working with depression, working with cognitions, rumination, risk, working with parents, groups, relapse prevention. So again, fairly extensive. We've got some things that go across all the both modules, such as working with imagery, comorbidity, which of course in CAMS is a big thing. I know your cases might not neatly fit into just anxiety or depression, and we know that. And just really thinking about specific competencies to develop your skills and how to end. In the third term, I say the third term, this might change in terms of possible part-time option, we give you a choice, and there's scope for you to think about what teaching you want, and we've always managed to kind of really deliver, I think, what a group as a whole would like teaching on if there's things they haven't had. So we've already talked briefly about the practice tutoring. I think this is where people learn the most, not just from being in the group and kind of getting feedback from a supervisor, but also just from watching your own videos and think about specific questions that you want to ask, and just becoming confident, I suppose, in showing actually how you're working. I think this is really important in terms of developing skills. It's a safe environment. The groups generally stay the same through the year so that people can feel that they kind of can trust each other in terms of showing their videos. And it's structured a bit like a CBT session, and yeah, I think it's a really useful part of the course. In terms of assignments, this is again just for CBT. There's other assignments that are for course skills if you're doing the CBT stream, which will be talked about later. But we have 3 case reports, one which is longer, which is 5,000 words for anxiety, and 2 which are shorter, 2,500 words for depression. And then we have 2 whole tapes, 1 anxiety and 1 depression that you submit, which is again kind of based around a competency measure, and a 1,000-word reflective analysis that goes with that. That sounds like a lot. It is, but you know, you'll be working towards that throughout the time.
Yeah. Sorry, is that 2005?
Yeah, I've made a mistake, haven't I? You can do that much if you want to. Yeah, I did notice that. Yeah, no. Just 2,500 words. And just to let you know, part of the reason why we have the assignments that we do is around accreditation. So I don't know how many of you are familiar with BABCP, but we're really trying to keep in line with BABCP accreditation, both for individual practitioners, but also generally we're working towards that as a course. And so this is in line with this, that you're ticking the boxes that you need, both in terms of showing your videos and in terms of the assignments to be able to apply for BABCP accreditation. This is just, I won't go into this in detail, this is just the session competency framework that we currently use, which particularly looks at change techniques. We won't go into that in detail, but we'll be particularly looking at what competencies you need to develop over the course. And just really lastly to say that we're expecting that through the time that you're, it says over the year, but we may need to adapt that, that there will be at least 8 cases that you will be developing your skills and using CBT in. Each case must have at least 5 sessions, which hopefully that will be happening. I know some of you are in services where it's quite time limited, but hopefully that would still fit. At least 5 hours of supervision should be received on each case. We expect not just the practice tutoring supervision, this is a really important point actually, that happens on site, but you will also be having a site supervisor. And that's going to be really important if you want to do the CBT course, that's in place before you start the course, because they're a really key part to your development as well. And we work together with site supervisors and practice tutors in terms of developing your skills. And the site supervisor would be the one still holding clinical responsibility and developing your CBT skills as well. So just to say, it would be really important if you are interested that you might be able to identify who might be a CBT supervisor who could supervise you throughout the course. So you will need both anxiety and depression cases, although of course there will be comorbidity, but we will be kind of assessing you particularly on working with anxiety and working with depression. I think that might be it. Is there any questions? Yes?
On the split of supervisors.
Yes.
Would that supervisor have to be CBT with children qualified, or could they be CBT adults?
I really would advise with children. Yeah. I mean, we can talk about that maybe separately, but yeah, it would be important for it to be someone within your service, which will be a child service. So it's not just about, I suppose, randomly getting a supervisor, it's about having somebody within your organisation who's going to help develop you, help develop CBT within that system. So yes, it would be really important that it's somebody who is in CAMS or within a child service. Any other questions?
On the accreditation side, is there much in addition to the course that needs to be done after this?
Not in terms of what you need to do. I don't know how much you're aware of there's you have to get provisional accreditation, and then a year later you have to get full accreditation. So there is kind of 2 stages for that. So you have to still fill out a fairly full-on form. They don't make it easy for you. But you will have ticked the boxes of everything you need to do, so it's not that you will have to do extra, you will have the right amount of hours, yes, you will still have to apply, obviously. We are thinking as a course how that will work in terms of full accreditation, because that's particularly about provisional. You will then have to keep your skills going to demonstrate that you're still practicing, you're still getting supervision in terms of getting full accreditation and then getting re-accreditation. So it's a process, it's not just like you get accreditation and that's it. You actually have to demonstrate that you're still continuing towards that, which hopefully, after the course, we would hope you would want to. And I think from our experience so far, people who've done the CBT module have really enjoyed it and found it stimulating and found that their skills have developed. So yeah, I don't know how many of you have got colleagues who have done the courses, but I'd really recommend that you talk to them and think with them about some of the what they found worked well, what was maybe more challenging, because that might be really helpful for you in terms of making that decision. Yes.
If you're receiving a BACB accreditation already as a counsellor, is that a different BACB accreditation?
It is different, yes. Yes, this is particularly cognitive behavioural therapy accreditation. Yes, it is